Would you like to add an extra $100,000 in implant revenue this year and every year? What if you could do that by adding just 6 words to your case presentation? That's exactly what we're going to cover, and we're starting right now. Sure, verbal skills are important, but it's not just the words. It's how you say what you say, and it's your attitude, which is way more important than what you say. And the attitude of the patient isn't nearly as important as the attitude of the dentist. Dan Kennedy taught us the attitude of the seller is far more important than the attitude of the buyer with respect to the likelihood of a sale. Allow me to share a story that illustrates Dan's point. There was a hepatitis C breakout in Worcester, Massachusetts. And though my father wasn't a dentist, he owned a dental practice in Worcester, and he had 3 general dentists working for him. 2 of his 3 general dentists got hepatitis C at the same time. So my dad called me and he said, would it be possible for me to come out there 1 day a week and help him keep the production going? I'll never forget my first day helping him out. I met with his team during the morning huddle, and one of his dental assistants starts out by saying, "Dr. Orent, your dad's told us all about the type of dentistry you do in your Framingham practice." So I'm thinking she's giving me a compliment. Nope. Not ever. She goes on to say, "That won't work here." She tells me that the majority of their patients work at the local factory. They arrive in blue coveralls with their name stitched in yellow, and she says their PPO is terrible, and they'll never accept anything beyond what their insurance covers, so don't even bother trying. Sad but true story. The likelihood of best option case acceptance is far more dependent upon the attitude of the dentist and the team than the patient. During my first day helping my father, my first recall exam was a young man, about in his early 30s. He had a mouthful of old, broken down amalgams. I recommended we start with 1 quadrant of bonded porcelain onlays and crowns. His response? "Doc, nobody ever told me it could be done that way." After which he accepted and scheduled the quadrant. That young man's response wasn't a fluke. During the months I helped cover for the docs with Hep C, I performed much of the same best option care in Worcester as I had been in Framingham. In a moment, 6 words that'll make a dramatic difference in your patients' lives and in your income. But first, let's take a look at the effect on your net profit, your income, when you reduce your practice overhead by just 10%. Let's say your overhead's 70% of collections. You keep 30 cents on every dollar. If you reduce your overhead from 70% to 60%, that extra 10 cents that you keep for every dollar collected, that represents a 33% increase in your income. If your overhead's 80%, well, you're keeping 20 cents on the dollar, so reducing your overhead from 80 to 70%, keeping an extra dime for every dollar collected, that's a 50% increase in net profit. Whether you're watching this during a global recession or during a financial boom, you'll take home more profit after you read my free report, 4 Ways to Get Your Overhead Under Control, Boost Your Net Income. It's less than a 10-minute read. Get your free report at freegem1.com. That's freegem, then the numeral 1, so it's freegem1.com. There's a link in the description below. Now for the 6 words. The patient in your chair has a tooth that's beyond hope of restoration. "Jim, when I take this tooth out," and now the 6 words, "would you like a replacement tooth?" It's really that simple. Every time you plan an extraction, in the same breath, "Would you like a replacement tooth? Would you like me to put a new tooth in?" Here's the math. If you convert just 1 extraction to an extraction plus implant each week, there's your $100,000. Now, if you're placing your own implants, that's a $200,000 annual increase. Credit where credit is due. My friend and colleague, Dr. Brady Frank, shared this verbal skill with me. If you found this helpful, I'd really appreciate if you could share this video with just 1 other dentist, and it would be amazing if you could click the like button so I'd know to do more videos just like this one. To circle back to what Dan Kennedy taught us, our attitude is critical. No judgment. It's not for us to figure out who might want the best care or who might be able to afford it. Adopt the attitude of presenting best option, lifetime dentistry to each and every patient without bias and without exception. Watch the transformation in your patients, your practice, and your income. Do you have a gem that helps you to increase case acceptance? And if so, let me know in the comments below. I read and respond to every comment personally. Remember, you're only 1 gem away.